Hi, today I will be presenting on childhood obesity, a public health threat. The research project is on how an increase in physical activities and exercise can help to decrease the prevalence of childhood obesity in inner cities. 18.5% of children aged 2 to 19 are obese, making childhood obesity a serious public health problem. 1 in 5 children and adolescents in the United States suffer from childhood obesity. However, all kids incur the risk of gaining more weight than what is considered healthy. 14.7 million kids and teenagers were afflicted by the 19.7% obesity prevalence rate. Additionally, some communities are more likely to have children who are obese. Children of Hispanic descent have the highest prevalence rate of 26.2%, and non-Hispanic Asian children have the lowest prevalence rate of 9%. Obese children are more likely to develop health risks such as type 2 diabetes, cardiovascular risk factors, and have a higher risk of morbidity and mortality as adults. Gaps in research. The current research on childhood obesity has mainly focused on medical aspects such as the prevalence, etiology, and health consequences of the condition. However, there is a need to understand social and behavioral factors. Research funded by National Institute of Health on childhood obesity examines psychological, behavioral, biological, and social factors for treatment. However, there is limited research on the prevention and intervention for childhood obesity in the first 2 years. In addition to the previous gaps in research, the Community Prevention Services Task Force determined that there was insufficient evidence to conclude if the programs involving healthier options and physical activity were effective in combating childhood obesity. This was based on a review of 4 unnamed studies from 1990 to 2017. Although there were great initiatives implemented, the studies showed that there was a lack of conclusive data, difficulty to apply research on a national scale, and low quality data. With that being said, the type of study we are proposing is an observational prospective cohort study. To answer the question, does a focused program on increased physical activities in school-aged children decrease the prevalence of childhood obesity in an inner city setting where the prevalence of childhood obesity is high? Obesity will be defined using the Centers for Disease Control and Prevention's recommendations. This study will be useful in the fight against childhood obesity and will provide awareness and may provide data for new policy proposals on childhood obesity. The target population will be school-aged children from the 1st to the 12th grade in New York, with moderate to severe obesity based on CDC classifications. A total of 500 children will be chosen from each borough for a total of 2,500 students. School children with underlying health conditions that make intense or strong physical activity unsafe will be excluded from the initiative, as well as those with obesity caused by a genetic or chromosomal condition. To accomplish this research, 2 sampling methods will be utilized. The initial approach involves random sampling, where 5 schools will be selected at random from 5 boroughs or counties within an inner city setting. Subsequently, quota sampling will be utilized to select subjects based on the stratification of school age by grade. Methods for recruitment include the research team collaborating with the selected 5 schools, reaching out to principals or administrators for approval to carry out the study, and interacting with teachers, principals, and counselors who can assist in identifying suitable participants. Research staff will also hold interest meetings and utilize the recruitment script to explain the study's purpose, benefits, and procedures. Distributing flyers and information packets at schools will also be a beneficial strategy used to encourage enrollment. This slide displays the stratification of school age by grade mentioned in the previous slide. Various quantitative data collection methods will be used. Some of the key methods include probability sampling, interviews with school-aged children and their parents to document eating habits, family histories, and demographics. This can be done through face-to-face interviews, telephone interviews, and computer-assisted personal interview, and the surveys will be conducted through SurveyMonkey. Additionally, structured observation will be utilized to collect data on the number of hours spent engaging in physical activities. The descriptive and unadjusted analysis will be used for the operationalization of the construct in this study on childhood obesity. The chart describes in detail the descriptive and unadjusted analysis and the measures used. Qualitative research is valuable to our research because it will assist in figuring out the prevalence of traits or qualities in those with childhood obesity. The data will also help to inquire about issues that are difficult to quantify, such as the causes, drivers of childhood obesity, and viewpoints of data. 2 sampling techniques will be used to complete this investigation: convenient and judgment sampling. A convenient sample will be the selection of 5 schools in the inner city where school-aged children are readily accessible. Researchers can assess a large pool of potential participants. This method is effective and cost-effective as it eliminates the need for extensive travel to search for school-aged participants, and it also reduces time constraints. Additionally, a judgment sample will be utilized to handpick students based on the researcher's judgment or expertise. This method will allow researchers to select individuals who possess specific characteristics relevant to the research question. The researcher will select participants from the chosen schools who have varying levels of obesity and physical activity. This approach would provide valuable insight into the impact of increased exercise on obesity rates within the inner city population. Several methods will be used for our qualitative data collection. These methods include interviews, which will include open-ended questions that can be answered verbally by the respondent. This will involve questionnaires obtaining data by the respondent written in an answer to an open-ended question. Focus groups, which include a discussion among groups to solicit and obtain information for research. Ethnography, which will involve active engagement in a community or group to observe traits and behavior patterns that can be useful for our research project, as well as literature review and in-depth analysis of peer-reviewed published work. Since the qualitative data measures are nominal and ordinal in nature, a numerical code will be assigned to the data set for easy transcription into Microsoft Excel. It is well known that obesity is a multifactorial issue that involves many facets of society. Therefore, understanding patterns in the data can help uncover potential contributors to childhood obesity. The qualitative data analysis for this study would allow for greater insight into the culture around childhood obesity in our population. As we know, children are affected by their environment, and it is important to understand how it relates to their overall BMI. Utilizing a combination of thematic, content, narrative, and discourse analysis will help to uncover underlying meanings and patterns in our research. In closing, it is evident that childhood obesity is a significant public health issue that requires immediate attention. The increasing prevalence of obesity among children and adolescents is a cause for concern, and our proposed study aims to further investigate and address this problem. Thank you.